have my chart for Cam Casey. He's a male, birth date 1/29/19XX. He's a full code, and I see that he has no allergies listed. I am looking at my orders, and I do see that he is ordered to get a nasal gastric tube inserted. This will be on the low continuous suction. So I want to know why. I see that he did have a CT done, and he has a small bowel obstruction. So I'm gonna gather my supplies. I'm gonna grab some for this. Okay, so I'm gonna be doing oral care, so I will have my oral care basin, a clip, tape, I got my page strips and my tubes. So now I'm gonna go to my patient's room. Knock knock.
Hello.
Hi, I'm Brandy. I'm gonna be your student nurse today.
Okay.
I'm gonna do hand sanitizer, privacy, make sure your bed's locked. And can you verify your name and date of birth?
Cam Casey, XXXX 19XX.
Okay. And Cam, do you have any allergies?
No, I don't.
No? Okay. No. Do you have any to latex or adhesives?
Nope.
Benadine, iodine?
Nope.
Any foods?
No.
Medications?
Nope.
Environmental?
No.
No. Okay, so I'm here today because you have an order to get an NG tube inserted. This is to help pump your gastric contents for that bowel obstruction.
Okay.
Before I begin, I'll have to do some assessments before we insert it. Have you ever had an NG tube before?
Yeah.
Yeah, so you remember it's a tube that goes through your nose, down the back of your throat, and then will proceed into your stomach.
Okay.
Okay? It can be uncomfortable, but it shouldn't hurt.
Okay.
So I have my table. Actually, I'm just gonna unlock these. I'm gonna raise you up so I can do some assessments on you. Have you had any past facial trauma or surgeries in your nose, throat?
No.
Nope. Do you have a deviated septum?
Nope.
Okay, so I'm gonna observe. I'm just gonna start with your face. I'm just looking for any obstructions, lesions, skin breakdown, any obstructions. And then I'll have you hold my nose and breathe. And then the other side. Okay. And I think we'll just use this one closer to me.
Okay.
And then I'm just gonna look in your mouth for any obstructions. Okay. Do you have any difficulty swallowing currently?
Nope.
Nope. Good. Okay. So I'm gonna listen to your lungs.
Okay.
Just make sure they're clear and get a baseline for you. And then just when I move, you can take a deep breath in and out.
As expected, so that's perfect.
Oops.
The next thing I'm gonna do is just you put gloves on before you do inspections.
Actually, and I'm just gonna slip underneath too, okay?
Okay.
Okay. Good. Good. Nice. Okay. Have you had any trouble breathing recently? Shortness of breath, cough?
No.
No.
Not really.
Okay. And then I would listen to the mannequin's back as well. Then I'm just gonna do a GI assessment on you.
Okay.
Do you mind if I pull your gown back up?
Sure.
Okay. So first I'm just gonna look. Looking for any bruises, lesions, abnormalities, any distension from your bowel obstruction. Okay. I do see a little distension on your stomach. Can you tell me how your pain is?
Oh, it's pretty high. I'd say like a 7.
Out of 10?
Yeah.
Okay. And where's your pain located?
Just in my lower abdomen, kind of in the middle, just cramping and bloated.
Cramp and bloated. Okay. Any like sharp pains?
No.
No. Okay. All right. So now I'm gonna listen for your bowel sounds.
Okay, so that is
If I didn't hear any, I would listen to each quadrant for 5 minutes each. Okay, I do hear some, but they're pretty hypoactive bowel sounds. So let's get this tube in ya, and then I'm gonna palpate on your stomach, okay?
Okay.
All right, let me know if there's any distender,
Yeah, it's pretty tender.
a little tender all over.
Yeah.
Okay, and when's the last time that you had a bowel movement?
7 days ago.
Oh boy, okay. And can you describe what that bowel movement was like?
It was hard and dry, painful.
Okay, all right. Can you tell me what your diet's like?
I just mostly eat like canned food, maybe a lot of steak.
Okay.
I don't really like vegetables or fruits very much.
Yeah. Okay. A good intake, of fiber in your diet will help get your bowels regulated.
Okay.
And your fluid intake, how's that?
I mostly just drink black coffee.
Okay. Yeah. Incorporating some water, some electrolytes, intake that fluid
Okay.
will definitely help with your bowels.
Okay.
So I'm just gonna sit you up to high high Fowlers. Okay. Are you comfortable there?
Yeah, that's okay.
Okay. Oh, he's gonna fall down. Okay, so before I begin, let me get my stuff set up. I have a towel for you, just in case.
Is it on the checklist?
My nose is running. I have my tube. I'm just gonna put my one-way valve cap on before we begin.
So I just want to
White, blue.
not to go below 30.
Okay, so first thing I'm gonna do is measure
Check on you periodically.
your tube, okay? Look
Okay.
at your nose. It's running. Okay, so I'm gonna go from the tip of the nose to the earlobe. Then we're gonna go down to your xiphoid process. Okay. So I got 50. So I'm gonna just temporarily tape this till we get it in, and then we'll mark it.
Okay.
Well, that'll do. Okay. Okay. I'm gonna need some tape, so let me get this thing. Okay, so that's just trash. So I'm just gonna prepare my tape. Okay. Now I'm gonna put some gloves on and we'll get started. So before, I'm gonna give you some water. Okay. And so when I start, you're just gonna tilt your head backwards, and then once we get to the nasal cavity, past that, we'll help you tilt your head forward.
Okay.
Okay. And then I'll have you drink your water while I insert it.
Okay.
Just, let's have a hand signal. So if you need to stop, just go ahead and raise one of your hands and let me know, and I'll
Okay.
stop and we'll reassess.
Okay. Yeah, that sounds good.
Okay, so I have my tube. I'm gonna lube this. 3 to 4 inches, and it's thick. Okay, are you ready?
Yeah.
All right, so we're gonna have you tilt your head back. That lube is so thick. Good, and then forward. And I'm just gonna make sure it's not coiling in the back of your throat. And drink your water. Good, good, good. Okay. Well, that seemed pretty smooth.
Yeah, that wasn't too bad.
No. So I'm just gonna hold this. And I have just some tape that we're gonna temporarily secure this with till I know for sure we're in the right spot. Okay, so now I'm just gonna pull some aspirate out of this. And hopefully my stomach isn't too empty. I'm just gonna adjust this, okay?
Okay.
Gosh dang it.
Can see some juices coming.
I see some, yeah. Okay, so I would aspirate. And I checked, and it's not coiled. I'm just wondering if my stomach is too low. It's trying. So I'd aspirate. Got some in there. I'm gonna check my pH. So my pH is at a 4.
Perfect.
Yep. And so that means we're in the right spot. So now I'm just going to get an x-ray ordered and secure this a little bit better and mark it with my marker. So I would mark it so everyone else knows where it needs to be and if it gets pulled out. I would skin prep his nose before I put tape on. Okay, so now I'm gonna have you go to x-ray and we'll confirm that for sure.
Okay.
I'm gonna secure this to your gown. Okay. So my patient's gonna go to x-ray. Well, first I'm gonna take the gloves off. Okay, so I'm gonna send you to x-ray. We'll make sure that that's in place.
Okay.
For sure. So when my patient comes back, I'll pick this up a little bit. Okay, so my patient's back from x-ray. Hello, welcome back.
Hi.
Looks like our x-ray confirmed placement.
Uh-huh.
So I'm gonna do some oral care on you,
Okay.
okay? And give you some education.
Okay.
Okay, so I'm gonna do hand sanitizer. During my procedure, I'd make sure my patient was not becoming cyanotic, vomiting, any difficulty breathing or coughing. My patient did pretty well. So here's your water,
Okay.
and here's my tublet. Okay, are you ready?
Mm-hmm.
Okay, I'm just gonna clean up. And I'll have you spit. Oh, spit, sorry. Drink. Spit. Okay, how's that?
Oh, much better.
Much better. Okay, and I'm gonna put some some lube or like a Vaseline on your lips and other nose. You make it a little dry, we can continue with oral care to help that.
Okay.
And then some, safety education. You're gonna be hooked up to a low suction continuous. So, you need to go ahead and use your collet and call us when you want to get up.
Okay.
That way, you don't rip from the wall or yank your
Oh,
tube out.
yeah. Yeah. Okay.
definitely a hazard. Don't pull on it. You know, try to avoid ripping that out because we'll have to do it again.
Okay.
Okay, so go ahead and use your call light. If you do start to experience any nausea or, you know, like vomiting, go ahead and call me. We can address that. Abdominal pain, let me know. You've got to keep your head at 30 degrees or higher. This will help. This will prevent aspiration from those contents being sucked up.
Okay.
So I'll put you there at 30 degrees, and then you kind of know your baseline.
Okay.
So here's your call light.
Thank you.
Do you have any questions or concerns?
How long will this be in for?
And probably until your blockage is cleared.
Okay.
So we'll just keep an eye on that until it's getting better.
Okay.
Okay?
Sounds good.
All right, so just gather all my stuff. And just a reminder, you know, nothing by mouth unless we get an order from the provider for like ice chips
Okay.
until that blockage gets cleared up. Okay, so here's your personal belongings. They are in reach. Your bed is down. You're at 30 degrees. Hand sanitizer, lock. I'm gonna open my privacy. All right, well, I'll come back in and check on you in maybe 45 minutes, see how you're doing.
Okay, thank you.
Okay, goodbye.
Bye.